order. Madam Chair, would you like to proceed?
Thank you. Let me get my papers organized here.
And I'd also like to point out that there are two spreadsheets posted. The one we're going off today is the one that's dated 4/9/25. It has the most updated numbers on it.
Thank you, Madam Chair. I would like to just make a few brief comments about the bill, but then we will move to amendments, and I have some amendments to adopt the DE and some other additional amendments that are coming from just making the bill kind of updating some things that we need to update. Anyway, I can go through those. We can go to member amendments and questions, and then we will conclude. We need to have the bill pass out of the committee and go to the tax committee. And if we can't finish by a little after 10:30, we do have a room reserved at, is it 5 o'clock or 6? 6 o'clock tonight. So if we are not able to finish, if we will resume at 6 o'clock. So members, you have before you Senate File 2669, which is the HHS omnibus bill. It includes finance and policy articles. Within the budget target we were given, we needed to think about, how we might have ways to protect Minnesotans' access to health care, given the great uncertainties that we're facing at the federal level. And simply meeting our targets through cuts was really not tenable for me as we planned out our budget. We devised a budget that does utilize a 0.2% increase in the provider tax and a reduction in the growth in the trend to be able to facilitate our development of the budget. It allows us to preserve coverage for now and puts us in a better position to respond to what might come forward this year when we know that discussions at the federal level of an $880 billion cut that will likely include substantial cuts to Medicaid might be coming and might greatly affect our Minnesota budget. And so the bill also includes 3 innovative proposals to help us address access to health care in Minnesota. 2 of them address medical assistance rates. One is to address the individual market and ways to address the fact that we don't have funding in place for reinsurance to continue. This budget strengthens access to health care. It avoids cuts to basic coverage, and it adds key low-cost coverages that will have meaningful impact, such as reimbursement for home birth services. It includes, as I mentioned, 2 bills, Senate File 2413 and 1402, which will especially help Minnesotans access health care by providing hospital systems to be able to capture consistent funding, and mental health workers and physicians will see higher payments for services, all of which are topics that we've discussed in our committee a great deal about how hospitals are in need of a better financing system, as well as our continuum of mental health care being inconsistent and people are not able to access the services they need. We have also provided innovative features in the budget to address barriers patients are experiencing in accessing the care that they need. The formulary bill that Senator Mann carried will allow people to access their medications for a year when they have a contract year with a health plan. We have considered impacts that we are already seeing due to federal cuts and federal economic decisions by including additional money for food support and and support for homelessness programming to serve some unique needs in our communities. We include investments in key areas of concern to Minnesota families and those who work to help them. We adopted the governor's proposal to allocate $10 million additional dollars to SSIS, the project to replace the SSIS system. And we've heard over and over again about how important it is to move forward with modifying and improving that system. We included a fiscal analysis to understand the full child welfare funding system. We have youth programming study to understand youth accessing programming across our state. And we included the governor's proposal to address fraud and our public programming systems by strengthening program integrity. We also, just a comment about concerns have been raised about increasing the provider tax by 0.2%. I want to just comment that, this is a tax that we adopted, the legislature adopted in 1992, and it was set at 2% for over 25 years. It was changed in 2019 when we were faced with a decision about removing the sunset. And at the time, repealing the tax was opposed by over 100 organizations. So we had a great deal of support for retaining the tax. It was a negotiated change to 1.8%, but I think restoring it to 2%, it maintains the stability of our healthcare system, and we know that this is a way that we can bring greater stability to our healthcare programs. With that, I would like to move to the different amendments. The key amendment is the A6, that's the DE. I'd like to move the A6 amendment.
Senator Wiklund moves the A6 amendment. All those in favor signify by saying aye.
Aye.
All those opposed? The A6 is adopted.
And then I'd like to adopt the A7, move the A7 amendment. And that, members, is the appropriations article. If you have any questions about that.
Senator Wiklund moves the A7. Any questions about the A7? Seeing none, all those in favor signify by saying aye.
Aye.
Those opposed? The A7 is adopted.
And then I would like to move to I'd like to move the A44 amendment, and that is it's an amendment that has a collection of items that need to be updated, and I do have, council is prepared to walk through this amendment and describe where the changes are located in the bill. So
Senator
if I could turn it over.
The A44 amendment, council.
Thank you, Madam Chair and members. So walking through the A44 amendment, starting on line 1.3 through 1.6, that reflects technical changes to terms used in Senate File 1030, establishing a dementia services program. Lines 1.7 to 1.8 deletes a portion of proposed new language from the governor's budget bill related to payment of a statewide hospitality fee that was not intended to be included. Line 1.9 through 1.19 is a conforming change to move this reporting requirement to an uncodified section. Reporting requirements are not included in riders. Line 1.20 to 1.26 updates Senate File 2499, a bill permitting overdose data sharing with new current language after the bill was amended in the Judiciary and Public Safety Committee. Line 1.27 deletes a section of Senate File 1534 on speech language pathologists that didn't actually include amended language and didn't need to be included. And line 1.28 to 3.5 reflect the reviser's technical recommendations to Senate File 832, a bill on establishing licensure for certified midwives.
Thank you, Madam Chair. Committee members, lines 3.6 to 3.8 show technical assistance provided by the Department of Human Services to ensure the single state PBM in SF 1574 is the correct entity type for the program's operation. 3.9 to 3.14 are technical recommendations from the revisor's office to SF 1574. Line 3.15 until line 3.23 show further revisor recommendations, however this time to SF 2413. 3.24 to 3.27 are technical changes to an effective date in Senate File 1402. Lines 3.28 and 4.1 make minor technical edits to clean up language in Senate File 1497 on audio-only telehealth. Then moving to page 4, the lines of the amendment from 4.2 to 4.4 show additional revisor recommendations, all technical, to a section in Senate File 2413. 4.5 to 4.7 make minor clarifying edits to clean up the language in a few lines in Senate File 1402. Line 4.8 corrects an incorrect expiration date of a subdivision. And finally, for me at least, line 4.9, which makes a change to properly conform the DE amendments language to the spreadsheet.
Madam Chair, members, line 4.11 through 7.31 are just technical changes. It moves two sections that are currently located in the behavioral health policy article to the behavioral health finance article because they are on the spreadsheet. Lines 7.32 to 8.9, these cleanup changes related to the boarding decompression pilot project proposal. Lines 8.10 to 8.17 are just further technical changes. 8.18 to 10.32, these are adding mental health policy proposals from Senate File 1953 that relates to complex post-traumatic stress disorder. Lines 11.1 to 13.15, these add mental health policy provisions from Senate File 1599. This provision prohibits clients from being charged for mobile crisis services. Lines 13.16 to 16.8, this adds more mental health policy provisions from Senate File 1953 relating to complex PTSD. Lines 16.9 to 16.16, these are conforming changes. Two sections in this article, we're amending the exact same subdivision. This reconciles those changes and then deletes the second section. Lines 16.17 and 16.18, this just deletes the two sections that were moved earlier before I started talking. 16.19 to 19.18, these add mental health policy provisions from 1953 related to training for providers on tardive dyskinesia. Lines 19.19 to 22.11, this adds more of the mental health policy provisions from Senate File 1953 relating to complex PTSD. I'm almost done, I promise. 22.12 to 23.8. This adds a policy provision from Senate File 1599 that prohibits co-payments, co-insurance, and deductibles from applying to mobile crisis intervention. Line 23.9 deletes a section related to substance use disorder, which is not in the jurisdiction of this committee. And lines 23.10 to 23.18 explicitly establish the Office of the Ombudsperson for Family Child Care Providers. Thank you, Madam Chair.
Thank you. Members, questions about the A44? Seeing none. All those in favor of adopting the A44 signify by saying aye.
Aye.
All those opposed? The A44 is adopted. Madam Chair.
Madam Chair, the next amendment I would like to take up is the A31 amendment. The A31 is an amendment that I believe ensures that the spreadsheet that was posted as the updated spreadsheet matches the language, and maybe if Senate Council could confirm that I'm saying that correctly, or fiscal analyst.
Members, do you have the A31? Yeah, okay.
Mr. Vessel, if Mr. Vessel could confirm that I'm saying that correctly.
Madam Chair, Senator Wiklund, and members, this amendment, the A31, just changes the appropriation amounts to match the revised spreadsheet on lines 2.3 to 2.9. That's just moving that rider to where the agency would be administering that grant program. And then lines 2.13 to 2.16 are new and reflect a technical change that came from the Board of Psychology to make it clear that they have those amounts in their budget for the Health Professional Service Program.
Madam Chair.
Senator Abler.
Well, thanks. I just wanted to take this chance to, this is like the most cryptic amendment you could ever imagine, and the last one was semi-cryptic with all the minor changes. But I just wanted to thank our staff. Every line, every little page 9, line 2, and all this, like where it changes a word, and the revisers, they've been up working on this thing for a long time. I presume they had a pretty lousy weekend and not much sleep last night, perhaps, with some of the timestamps. And I just wanted to give them a word of shout out to this crew, and then I didn't get a chance to say the same thing for the Human Services Committee, but to the reviser staff and the fiscal staff and even people that aren't even here. They just work really hard on this. Whatever we think of the bill, to put this together is a mammoth undertaking. So I just wanted to acknowledge them and thank them for that. And this amendment is a particular example of nuanced, fine detail. And so anyway, I think it's a good amendment, Madam Chair.
Thank you for that, Senator Abler. Anything else on the amendment? Seeing nothing else, all those in favor of adopting the A31, please signify by saying aye.
Aye.
All those opposed? The A31 is adopted. Madam Chair.
Madam Chair, now I would like to move to, there are a couple amendments that are more technical in nature that were brought forward by agencies and the boards. One is, the first one is the A37 amendment. I'd like to move the A37.
Senator Wiklund moves the A37.
Do we have that, or that needs to be passed out?
That one is getting passed out. Did you want to speak to that one?
Thank you. Madam Chair, the Department of Health came forward with some language that didn't get included in the bill initially, and they would like to have added. It is corresponds to other sections that are in the bill. I don't know if Ms. Heichel, if you could, I don't know, just relay a little bit more about this amendment.
Thank you, Madam Chair and members. The technical updates from the Department of Health are mainly related to fees for food, pools, and lodging. I believe that these are all included in the spreadsheet. They were just not included in the bill. So it's not any new fees being added that weren't already in the spreadsheet, just a conforming change. Thank you.
Members, questions?
Madam Chair,
Senator Wiklund.
you probably knew, I didn't know we had registered sanitarians, but I'm glad we do, and I'm glad for their sanitary stuff.
Okay. All those in favor of the 837 signify by saying aye.
Aye.
All those opposed? The 837 is adopted.
And then I have the A39, which I'm not sure if that was passed out. Is that, okay, that will be passed out. This is a technical amendment that was brought forward by the health licensing boards to us yesterday.
Senator Wiklund moves the 839, which is being passed out.
And again, I might ask Ms. Heichel if she can shed a little bit light about what the different sections are for.
Thank you, Madam Chair and members. Similarly, the A39 amendment is conforming changes, things that were missed, that were just not included in the larger bill related to a couple of the specific repealer sections that were intended to be included, that were in the governor's budget bill and were intended to be included in the larger bill that were brought to us by the licensing boards. Thank you.
Members, questions? Senator Ruckey.
Thank you, Madam Chair. Could we get a little bit more on what those repealers are?
Senator, may I just have a minute to find the citations? I don't have it off the right in front of me here.
I don't know if Lindsay is here. And, Madam Chair, I don't know if the boards, if Lindsay Franklin is here.
Anyone from the boards here?
And Madam Chair.
Senator Abler.
And so if it could just be made clear to me, I don't know if we're to go through all these would be a lot, but it would be helpful for me to know that these were all in the original governor's bill, so all the board and people who care about this would have had a chance to review those and offer their objections. That's a question I would have as well. So, related. Thanks.
Madam Chair, that's kind of what I'm looking at, just a high level. There's a whole lot of them here, but what is the high level? Just there's not each one individually.
Welcome. Introduce yourself.
Good morning, Lindsay Franklin. I believe the majority of these repealers are related to the fees that are moving from rural to statute. But I would need Senate Council to confirm that.
Yeah, Senator Aki, these were all included in the governor's budget bill initially.
Okay, to move on? Okay. All those in favor of adopting the 839 signify by saying aye.
Aye.
All those opposed? The 839 is adopted. Senator Wiklund.
Madam Chair, next I would like to offer an amendment that I have that is not distributed, if it could be distributed, the A30 amendment.
Senator Wiklund moves the 830, which is being handed out.
And I can just begin speaking about it. Members, we've had a lot of discussion about optometry and scope of practice both last year and this year. And as you noticed, I'm sure in the bill, I included the changes that the optometrists had included in Senate File 1144 for medications, and did not include the language for the injections that they had come forward with this year. They had made changes to the bill from last year. I've had, I guess, some concerns still remaining about the injection capabilities that they're requesting. And so I worked with Senator Mann and Senator Klein. We've had concerns about just giving this authority to optometrists. What the A30 does, what it proposes is that it would include the language from Senate File 1144 as the optometrist proposed it for injections. And then it would add a clause that states that optometrists would need to be set up a collaborative practice arrangement with a physician so that there is some oversight and collegial work between the optometrist and ophthalmologist on ensuring that the correct ability or correct procedures are performed in the correct manner. It's something that may need more work, more definition, and I'm open to having discussion about how to make it work better. But it's a way for us to continue to have the discussion about whether adding these capabilities are appropriate at this time, and do they need any type of additional guardrails. I have done quite a bit of looking at other states and what they include in their practice acts, and while I know the optometrists have stated that many states do allow it, I've looked at more closely. I've looked at Iowa, for example. They do provide for optometrists to perform these types of injections, but they have a full statement about training for the administration and side effects of injection treatment shall be required before a licensed optometrist may administer such injections. So there are some guardrails there. In Washington State, they do allow for some of these procedures, not all of them, but they also have a statement that says that optometrists shall not perform any advanced procedures listed in the subsection until he or she receives a license endorsement issued by the optometry board. I'm not proposing that same method here, but the collaborative agreement would provide a way for us to have more assurance, I think, that the optometrist is fully trained and physician is available to provide guidance to them. So I'm proposing that, and so I'd like to move the A30 amendment.
Members' questions, Senator Liskey.
Thank you, Madam Chair. Madam Chair, Senator Wiklund, I appreciate your attempt to get this all to the table, right? I think the discussion that we've had, especially over the last 3 sessions that I've been here, from what I understand, optometry's been having this issue for a lot longer than that, but at least this is as long as I've been here, so I can only speak to what I experienced. Reading this amendment is very concerning to me in the fact that we are now creating a situation where one provider has a license over the top of another provider who are normally 2 very separate licenses. It'd be like saying, hey, the chiropractic license is good, but every procedure that they perform now has to be performed under the supervision of a medical doctor. It doesn't make much sense. This type of language definitely doesn't exist in the rest of the United States. I don't think there's any situation where this would be the supervising a doctorate level supervision from another doctor. It just doesn't happen. And that's why I would have major concerns with this language. I get that there's some fear around subtendon intravenal injections or intravitreal injections, but that's not the same thing as the surgeries that the ophthalmologists were talking about during their testimony yesterday. It's concerning that we're in this discussion again where it's the ophthalmologists are getting what they're wanting, the optometrists aren't getting heard, and I don't know how we're going to get past that without doing the optometry bill as a whole, and so that's what's concerning to me. And so with that being said, I'm very opposed to this language. I think there's a better way to do this, and I do have another amendment that I plan to bring and to see what we get, and I post that publicly so you kind of do know what it's going to be. I'm definitely not interested in this amendment because I think this just goes too far.
Members, other questions, comments? Senator Port.
Thank you, Madam Chair. Thank you, Senator Wiklund. I do appreciate all the time that you've spent with everyone engaged in this conversation. I think, for me, this is a question of the patients, of access to care. We know there are huge deserts across Minnesota where there are just no ophthalmologists. And those folks need that care as well. I would be more open to some sort of training requirement or certification as they have done in other states, but I think this would continue to leave really big swaths of Minnesota just without access to this kind of care, and that makes me nervous. I think that there's still a lot of good conversations that we can have, but I think for me that access to care is what's really important, and I think we should try to find a path that opens up care to folks, and I'm not sure that this does that except in the areas where there is already some type of access to that care through an ophthalmologist already being there. Madam Chair, I just want to say that I can see that. I can also just want to raise up that the procedures that they're talking about are pretty rare and should be, are most likely are things that would be watched or treated in other less invasive ways before they need to perform these procedures. And maybe they should be the type of procedures that, are referred to an ophthalmologist. But I do take your point. I do understand that it is felt that ophthalmology access is challenging in some parts of the state.
Senator Rucky.
Thank you, Madam Chair. And just weigh in a little bit too. A lot of things have been covered, but we do have a huge service desert in rural Minnesota. And what the optometrists are asking for is, once again, just to practice to the level of their training, to the level of their license. And that would do wonders for what we need out in our rural areas. We have people traveling, an hour at a minimum, 2 hours probably on average in a lot of cases, to get to the ophthalmologist who, there's things you have to go to the ophthalmologist for. They have the expertise in a lot of things, but there's a lot of these procedures or follow-ups that our optometrists can handle very capably. And we need to let them do that. It's been mentioned how many years, I can't tell you how many years I've been hearing this since I've been here. It's high time that we just let them do what they're trained to do. And that's why I can't support this either, because we can't tie their hands. We need to untie their hands and just let them do what they want to do within their license, within their training, and create that extra access to care across rural Minnesota that we need so badly. So I hope that when we hear another amendment later on here, that we can support that so that we can move this forward so that our people can get the care that they desire. So thank you.
Members, other comments? Senator Abler.
It's just too bad we're even having this discussion. I have struggled with this topic from way back when there was Representative Nornis was taking this on, who can put salve where, and then we have to decide, and with the exception of maybe Senator Mann here, none of us have any direct connection, maybe Senator Bolden, but it's like, and now we have to decide, and so I just like to point out the good news. It appears that there's been an agreement on the medication side, which is a good thing. It appears that that's a truce there. However, the optometrists, I think, are rightfully concerned that at the end, the governor's not going to go along with this. There was some claim that there was some kind of, semi-bribery going on. It's a claim, it's an allegation, I don't know, but suddenly something happened and then nothing happened. And so I think there's a lot of insecurity, and I think, frankly, the behavior of the ophthalmologists and some of their testimony has been, like, I don't know, not productive. And I sided with the ophthalmologists back in the original thing. So, and my comment was, like, keep working in good faith. It appears there's a new crew in charge of the ophthalmologists now, and I really admire that they can recognize the errors of the past as they come forward. But I just want to remind the new crew there that trust is very low. And if we make an agreement here, whatever it is, it still has to go to the House. And they managed to get a single page, I think, out. They did forecast adjustments. That's the state of the bill that goes against, that's the counterpart to this. And that bill's going to be decided in Ways and Means and on the floor, which is great idea. So in this world of uncertainty, I think the optometrists should celebrate the fact they've got a beachhead there. And at the end, you have a conference process. And that is totally unknown territory. And my counsel to the optometrist was, like, seize the day, take what you can get. You don't know where the best you can get is, what's the best to get. Stock markets are down. Should you buy today? It went up a lot yesterday. Should I have sold? And so people that try to get to the top of the market and sell, maybe you're off a day. And so I just want to encourage them to continue with that. I see this amendment as, I like both amendments, because neither is going to be the final answer. But this needs to advance. I'm going to vote for this. If it doesn't go on, I'm going to vote for the next one. Not for any antipathy to anybody, but we got to get something done. And to the optometrist's point of view, if you had to go home with this, pretty good deal. The nurse practitioners have had collaborative agreements, and then when people became more comfortable, we got rid of those. And so this is at least 5 years going on. So Senator Wiklund, thank you for your effort here. Is this the best final answer? I don't know. They think we're coming in for a landing. You know, it goes this way, it goes that, and eventually land on a final resolution. This is the furthest along this topic has been ever. And so how do we lock it in? Where's the best place? I tried to... I don't know, the weatherman and I are going to figure this out, you know? And that's meant to be a friendly comment. So thank you, Senator Wiklund, and let's keep on. We're going to get something, and I'm happy. And we got to fix the desert. Thank you.
Thank you, Senator. And I also add that collaborative agreements certainly do exist. Like you said, Senator Abler, nurse practitioners certainly still to this day when they come out of training with physician assistants, that is not a new idea. And I think too, we have a physician shortage across the board. You know, we have a general surgeon shortage. We're not going to tell family doctors to start performing intra-abdominal surgery because we're short in surgeons. So I think those are all things that we need to consider when we talk about how to fix our medical deserts. Having said that, Senator Wiklund, final thoughts.
Well, thank you. I was going to point that out too. I think there are areas where other professions that have collaborative agreements, whether this language is the precise language that works, if it constrains access or constrains the ability of optometrists to find a person to have a collaborative agreement with, that would be something that we need to have more discussion about. I guess at this point, I don't foresee that my amendment is going to be successful, so I'd rather withdraw it. I don't know if Senator Liskey, if you'd like to continue the discussion and raise or bring forward your amendment, we can talk about that now, or we can wait.
The A30 is withdrawn. Senator Liskey?
Thank you, Madam Chair. Madam Chair, I'd like to offer the A10 amendment.
Senator Liskey offers the A10 amendment. Senator Liskey, to your amendment.
Thank you, Madam Chair. Madam Chair, Senator Wiklund, this bill is really, or this amendment is really just putting the entirety of the bill back into the language. It allows for the subtendon, retrobulbar, or intravitreal injection. You know, I want to kind of stem off of what Senator Mann and yourself have said is, yes, there are collaborative agreements with nurse practitioners, with physician's assistants. Those aren't the same situation that would have been created with that last amendment. We're talking doctoral level education versus people who are striving to get further in those types of levels of things. So that's not the same collaborative agreement. And so with this specific language, the whole purpose of it is it allows them to work within their scope of practice that they've been trained in, that they've gone through the education, through the time, and that it's already there. If there's language, like you said, that like from Iowa, that just talks about how they have to prove that they have that training to make you feel more comfortable with this language, I'd be happy to talk about that as an option. I think they already do that training, so the fact that we just would put that comfort language in there, probably pretty easy, and I'm pretty sure the optometrist would be on board with that discussion. So with that, I look forward to hearing other members talk on this.
Senator Wiklund.
Madam Chair, Senator Liskey, I guess when I put the bill together, I did so in a purposeful manner, and so I'm not that interested in just putting the bill language as it was in the bill. I will certainly, if you take it, if this goes to a vote, then, you know, members will have their say. For me, I think I've explained why I have concerns about just giving this authority without having more constraints or oversight. But I won't go through all of that again, so.
Thank you, Senator. And I also add that many nurse practitioners are doctoral level, and this would not allow for subtendon, retrobulbar, or intravitreal injections. Members' questions, comments? Senator Abler. Senator Epke.
Thank you, Madam Chair. And I didn't give Senator Kupek a heads up on this at all, but I will just bring it up because of his location. He's even closer to the border than I am. He can throw a stone across the river. But the optometrists on Senator Kupek's side of the river would be restricted. You go across the river, that optometrist now could do everything we're trying to do. That's the challenge that we've got. They've all got the same training. They've all got the same license, so to speak. I don't know if there's differences between Minnesota and North Dakota there, but the fact is their training and everything is the same, but on one side of the river you can do it, on the other side of the river you can't. That's the thing that's the challenge we're trying to overcome. It's bringing fairness, and bottom line is bringing those services back into Minnesota. So thank you, and I don't mean to put you on the spot, but that's I think that's where you're coming from too. Thank you.
Senator Abler. Senator
Kupek, that's the name, thanks. Turn this way. No, and yes, just Senator Utke's comments, and it's not just the practice on the other side of the river. It's I have optometrists who have practices within Moorhead, and eventually they're going to want to retire and sell that practice. They cannot get the same price that selling their practice as one of their counterparts could across the river in North Dakota because they're limited in what they can do. And it's also, when they're trying to bring in somebody new into their practice, it's also a competitive thing because in North Dakota they can just do this and like, well, I'm going to go over there and work. So it is also it gets into one of those bizarre border competitive issues. Besides the fact that when you go out further, I friends up in Crookston who are driving to Fargo to get treatment that they could probably get in Crookston because we're not allowing that. So it is, particularly in greater Minnesota, it is a huge issue.
Senator Abler.
Well, thank you. I appreciate this amendment. I intended to vote for it all along as a way to keep the discussion going. I said what I said earlier, but I want to caution the optometrists As this bill goes forward, you have Senator Wiklund and Senator Mann have their own sincere concerns about it, independent of any exterior pressure. There was some external pressure. And I think when you have a bill that's controversial and there's a major party who is kind of disinterested in that way, I think that that's interesting and frankly unheard of on topics like this. But that still remains a peril. And so just keep talking. I'm doing all I can to force you into a room to continue to talk. The last one was similar. I'm not sure if either one is going to be the final answer. Maybe training fixes it. We don't want optometric deserts. But I want to get this. This is like, needs to get done. But it wants to, you want to, this, I'm just trying to be careful talking about external pressure, but there are things behind the scenes that happen all the time where wonderful proposals fall off because there was a phone call. So I guess that's as much as I'm going to say, but it's, at some point you need to come to an agreement with all the parties where they're comfortable. And just because you have the votes today and on the floor doesn't mean you're home yet. And please keep talking and come up to an agreement that all the parties can say, we can live with this, this is a sensible one. And talk to the ophthalmologist. You've heard your name with this previous work, and I think you're admirable with your practice, but on the political side, it's not been good for you. And so that's my counsel to everybody, and I hope that openness helps us come to a resolution, because we do need the services of all this stuff. Thank you.
Madam Chair,
Senator Wiklund.
just one comment. I do appreciate that you're hearing that in North Dakota they can do more things. I just want to state their Practice Act, it does say laser therapy and use of invasive surgery are not permitted under this chapter, except superficial foreign bodies may be removed and primary care procedures may be performed. They do not have explicitly the authority that we are discussing here. So I just want to make it so that we're all clear that it is not very clear amongst states. They have different practice acts. They are able to do different things. It isn't as simple as saying that everybody can do what we're proposing to include today.
All those in favor of the A10 signify by saying aye. Aye. All those opposed?
No.
The A10 is adopted.
Members,
Senator Wiklund?
I don't have other amendments, and I would suggest moving to member amendments.
Let's go to the A8, Senator Bolden.
Thank you, Madam Chair. The A8 is in relation to the certified midwife portion of the bill. As you will recall, that creates a new pathway into midwifery. It mirrors the process for certified nurse midwives, but offers another pathway. And so the language in the A8 is rulemaking language, which did go through and was heard in state and local government, but is just adding it into this bill to allow, again, for the same process that we currently use for certified nurse midwives to be the process we use for this new pathway of certified midwives.
Members' question on the A8? Seeing no questions, Senator Wiklund.
I support the amendment and trying to get the bill all in the complete form that it needs to be.
All those in favor of the A8 signify by saying aye.
Aye.
All those opposed? The A8 is adopted. Move on to the A9, Senator Bolden.
Thank you, Madam Chair. The A9 is also in relation to the certified midwife bill. This is some technical changes that were requested by the Board of Nursing to, again, align with the practice and just add some clarity.
Members' question on the A9? Seeing none, Senator Wiklund.
I support the amendment.
Members, all those in favor of the A9 signify by saying aye.
Aye.
All those opposed? The A9 is adopted. Senator Bolden, you want to keep going? Do you have anything else? All right, let's move on then to the A11. Senator Kupek. Whoever. Okay, does somebody have the A11? You do have the A11, okay.
I put mine in the wrong order, Madam Chair. Sorry. So thank you. Yes. I have the A11. The A11 is basically the bill we heard from Senator Hochschild relating to rural ambulance. It sets up the potential for funding for rural ambulances, but it does not have any funding to go along with it at this time. But it's just getting the things in place as hope springs eternal that there will be some funding in the future.
Member questions about the A11? Senator Abler.
Well, Senator Kupek, is this like a thunderstorm without rain?
Senator Kupek.
Those do exist, Senator Abler. Dry thunderstorms are out there, so yes, this may be the equivalent of a
Senator
dry
Wiklund.
Madam Chair, I have had discussions with Senator Hochschild about including this language. I guess I'm okay with it. I think it does need some additional discussion about how the program would work. But I understand the desire to have a place to, if we do find that there is a way to include some additional funding for EMS. So I'm okay accepting the amendment.
All those in favor of the A11 signify by saying aye.
Aye.
All those opposed? The A11 is adopted. Who wants to go next? Senator Kupek.
Sure. How about we do the A13, which I'm sorry is not, I don't think, in your packet, but a clerical error did not say posted and handed out, but.
Senator Kupek offers the A, what did you say, 13?
A13.
13, which is being passed out. You want to talk about it?
Sure. 1 second here. It is basically, it is for a program to make sure that we are dealing with Minnesota vendors around this issue and not also duplicating some of the services. So kind of clarifies it. Talked to DHS. They're in favor of the A13 too. So.
Members, questions? Senator Wiklund.
This seems to be a good amendment, and I would support it.
All those in favor of the A13 signify by saying aye.
Aye.
All those opposed? The A13 is adopted. Senator Kupek, do you want to keep going?
Sure, I have one more.
Okay.
Let's go. I have the A18.
Senator Kupek offers the A18. Go ahead.
So to the amendment, we had a couple of other EMS related bills in here. Senator Seeberger had one, Senator Hoffman had one, and in the bill here we have Senator Hoffman's bill. That's been kind of the language from his that has been adopted, but some of the fire departments had asked, and we had voted on this and amended this on to Senator Seeberger's bill. They had been asking for some extra reporting data, and we had put that on there. It is not in Senator Hoffman's bill, and so the fire departments would just ask that we put this extra reporting data into the bill to go along with the language that we have.
Members, questions? Senator Wiklund.
I support the amendment.
All those in favor of the A18 signify by saying aye. Aye.
Aye.
All those opposed? The A18 is adopted. Who is next? Okay, so we are going to move to reconsider the vote on A7, which was previously adopted, so that we can take the A12. Okay.
Okay.
Senator Abler makes that motion. All those in favor signify by saying aye.
Aye.
Aye. All those opposed? The A7 is reconsidered. And now we will take the A12. Senator Uckey.
Thank you, Madam Chair. I'd like to offer the A12 amendment. I believe that should be in your packets.
That is in your packets.
Okay. Members, the A12 moves, and I guess there's only two of us that were in Human Service, three of us in Human Services yesterday, we did the same thing. And we are adding base riders to the appropriation article. And in the big term, or the big word is, this just adds transparency. When we, as a committee and as legislators, go through this process and we appropriate funds, in the past, it kind of falls off the side and there is no tracking to it. So with ridering, we provide an essential connection between the appropriation and the law that governs how the money is spent. You could look at a couple different things as an examples. If you go to line 9.21, I'll just walk you through a couple so that you understand what we're looking at. And do I, yeah. Okay, that would have been of the A7, but anyhow, you see that, that's a small appropriation, 2.2 million, and it's on the lower end of what we work with. But then if we went to line 8.19, where there's a larger appropriation, but yet only, I believe it was the 125,000 was actually ridered or followed or tracked in that system at that point. The rest of it was so-called open for interpretation. So what we want to do with this is now all of the appropriations have a path to follow. We can see that the appropriation will follow the intent of the legislation, and in the end, when it gets to the end of the term, we can see what happens with that money. So it's it just goes back. It's transparency at its finest. This used to be the case. Then you'll also see a term at the end of the appropriations article, an expiration of uncodified forms or uncodified language. These are things that we used to have, and they kind of disappeared back or came about in back in the early 90s. So we're just trying to get back to where, and actually, as we sit in other committees, you will see that this is common practice in all the other committees, but we didn't have it in the Health Committee or the Human Services Committee. We want to bring this forward so that we have that same transparency. So with that, members and Madam Chair or Senator Wiklund, I ask for your support on A12.
Members, questions? Seeing none, Senator Wiklund.
Thank you, Madam Chair. Senator Etke, thank you for being interested in seeing this move forward, and thank you to fiscal staff and Senate Council for getting this all coordinated. I think it will be a helpful way for us to move forward and have additional transparency in the budget bills going forward.
All those in favor of the A12 signify by saying aye.
Aye.
All those opposed? The A12 is adopted. And now we can adopt the A7 as amended. All those in favor signify by saying aye.
Aye.
All those opposed? The A7 is, as amended, is adopted. Senator Uckey, do you want to keep going?
Yes, thank you, Madam Chair. Let's do the A42.
Senator Uckey moves the A42, which needs to be passed out. You want to talk about it while it's being passed out?
Sure. Members, this is a fairly simple bill. It's a collaborative management agreement for the armed forces, and it affects a dental therapist. If they're a practicing dental therapist under our Minnesota licensed laws, they work under a licensed dentist. This amendment says that arrangement where the dental therapist would be working under the Minnesota licensed dentist in their normal practice here in our state, but in the armed forces, that isn't in play, that they would then be under contract of, the collaboration of the dentist within the command structure of the armed forces. So it's just allowing them to separate so that that dental therapist could practice their craft for the armed services, but be under the arrangement of the branch of the Army or the Armed Service if it's all in general, but yet it allows them to do that, and they wouldn't then be connected to their Minnesota-based dentist that they would be back at home. So it's just bringing the armed forces into this agreement and allowing that process to go forward.
Members, questions? Senator Abler.
Well, thank you, Madam Chair, and I think the dental therapist thing predates some people here. They came into being because the regular dentists, frankly, just couldn't afford to serve Medicaid clients because the rates were below their cost. And so the legislature, and I don't know, maybe this came from somewhere other states too, came up with this mid-level dentist who can do fillings but not extractions. And it was as much of a discussion as the last optometrist thing. But this is a good idea, but I also want to point out there is a time for people to be in a collaborative agreement until people are comfortable, and then it moves forward. There'll be a bill someday to get rid of this collaborative agreement because they're doing so well in their training and all that. And just thanks for making this more available. So there are dental deserts too, I think. So, thank you.
Members, other comments, questions? Senator Wiklund.
Thank you, Madam Chair. Yes, I support the amendment. It was brought to our attention by the dental board, or the Board of Dentistry, and I appreciate their bringing it to our attention.
All those in favor of the A42 signify by saying aye.
Aye.
All those opposed, the A42 is adopted. Senator Utke. Yeah. Has anybody else got an amendment? Senator Abler.
So anyway, I'd like to move to A14.
Senator Abler moves the A14, which is in your packets. Go ahead.
Yeah, and I tried to put all my amendments ahead just so people could look at them. We discussed, this is flexibility for the departments in times of uncertainty. We talked about the CDC changes, which I wrote a letter to them and called that morally indefensible to, change happens, you have to do it not so abruptly and like yesterday. And as a result, the Department of Health had a very clunky way to try to balance their workforce. They laid off 170 or so, and then it was a mistake, and they had to unlay them off and then relay them off. And I met 6 people who were in that category, including some people that were very long in tooth and really important public health, infectious disease seats. And I have not had a chance to talk to the commissioner about this, why that would happen. But I just, we have a lot of meetings, Madam Chair, and that was just one of the more grievous meetings with those 6, I think it was staff. There was one bright young woman who was eager to become part of the team, and now she'll have to go off and do something else, and she'd just been hired and now not anymore. And so I understand workforce and staffing and all that, but there's no way on earth that we have the ability here to do a good job of that. And at some point we need to decide we're going to save some money. We're $36 trillion in debt, paying $1 trillion a year in interest as we continue to seek increased federal funding, and even in this bill, like it's somehow Uncle Sugar has got a whole endless amount of money. And I'm not even here to mention that, but I just want to make sure that as we go forward, that the commissioners and the people at the department who know what they're trying to accomplish as their key elements to do will be allowed to do it. This language is not the final version by any means, but I'd like to, if we can put it as a placeholder. I talked to, been in communication with the Department of Health and DCYF and DHS about what would be good language to go forward with so they have the flexibility. We made some jokes about it yesterday in the Human Service Committee about totalitarian power, and I'm not after that, but I do think that we want to be sure as we go forward with whatever's going to come out of this budget. I'll predict the budget that the Department of Health gets is not going to be the governor's budget. And I told that to Commissioner Cunningham when she was here. I said it's aspirational. I don't believe a lot of the fees are going to go through, and I believe all the departments have to find a way to focus their work. And so this is meant to be very friendly to them, to help them do what's essential. And I'm committed to working with anybody who wants to work on it to make it narrow as it can be to protect, our role. But that's my amendment, Madam Chair. So thank you.
Members, questions? I guess I have a question of, services may be temporarily restructured. What does temporarily mean? And then during periods of financial hardship, what does that mean? Because I would argue that our public health departments are always under financial hardship. So those would be my questions. Senator Wiklund.
Thank you, Madam Chair. Senator Abler, I saw you had a similar amendment in Human Services yesterday, and we talked about it. I guess I have a lot of concerns about the terminology and what financial hardship is, as Senator Mann mentioned. Creative ways, I think, is another wording that I'm not sure I have that is very clear. I think in Human Services, consensus was that we would not adopt it, and we did not adopt it. I would really prefer to do that as well. I'm happy to have more discussions. I would really like to hear before moving forward with language like this, I would really like to hear from the commissioners and talk with them about what is possible. I think we have established processes for various situations, and we're in sort of uncharted situations today that maybe we haven't anticipated, but we did set up processes to try and deal with emergencies and other types of unusual events. So I guess I would like to understand better what we have in place, and then where would flexibilities be helpful as we go forward with knowing that there is a lot of uncertainty ahead.
Madam Chair.
Senator Abler.
Yeah, and I'm fine with that. I would like, I just was surprisingly moved by that interaction between the governor's abrupt action to make me come back to work, and they were all like, where are we going to park? And I mean, there is plenty of abruptness going on everywhere, and I think lack of attention to detail, both federally and here, particularly on some of that stuff, by these executive, but the demand that they come back without even talking to the people and asking me people ahead of time. I'm willing to withdraw it, but I hope that if I can bring it to the floor with an agreement, nobody will argue that it's not germane or something. That's the only reason I would want it to go today. But if that's not an issue, and I'm trying to skirt the knife edge here, like on the last licensure bill, and we need to find a way to retrench. We cannot afford things we've committed to do in Minnesota as a country. And so there's retrenchments coming. How do we preserve what's the most important? And there's plenty of blame to go around to who's made particularly not very good choices. We can't shift a third of the money to the counties, or if the House did almost half their target to the counties. Like, that's just pure impossibility, and raise property taxes on seniors and people with disabilities and people barely hanging on to their homes is not a way to solve it. But we also have to preserve our services for people with disabilities, not this committee, but also tuberculosis and these infectious outbreaks that are coming, that for some reason they laid off people that are doing that very thing in Minnesota when they had other departments they could have found more, less critical to that. So Madam Chair, if you can just acknowledge that I can keep working on this, and we'll find and every comment you made about the words, if you look at the timestamp, it's kind of fresh, So thank you, Madam Chair. So if you could just comment about that, that'd be great.
Senator Wiklund.
Madam Chair, Senator Abler, I'm happy to keep working with you, and happy to take, if you come up with alternatives, I'd be happy to review those, and I don't see a reason to, I'm not going to say, no, we can't do this on the floor, so.
Yeah, thank you. Well, Madam Chair, I'll withdraw. Thank you.
Senator Abler withdraws the A14. Senator Abler?
Yeah, do you want to, am I doing the A16 too, Buck? Okay, I'd like to move the A16 and have Mr. McAlpin come up and describe it.
Senator Abler moves the A16 to the A16.
That's the ambulance one.
welcome. Introduce yourself. Proceed.
Yeah, Madam Chair, members, Buck McAlpin with Minnesota Ambulance Association. This is just some language. I've shared it with DHS. It's a bill that was introduced in the legislature this year. It was not heard in the health committees, but with all the conversations around directed payments and what we see nationally across the ambulance industry is some work on leveraging federal money when it's available for the ambulance industry, with the increase of medical assistance, obviously, as we've talked about in this committee with other types of bills like this. But this doesn't mandate DHS does anything. This just says that DHS may implement a program like this. Currently, there is an intergovernmental transfer program for governmental fee-for-service. And as you've heard in this committee before, about half the ambulance services are governmental. Also, we see lots of tax dollars spent every year from counties and local governments in the EMS industry that's not used to leverage any federal match. And we would just appreciate it if the chair and Senator Wiklund would accept this language and be a placeholder to have a conversation. DHS may have some more input with it, but hopefully there's not a fiscal cost to it. And to continue to look at opportunities to leverage money for our ambulance industry, especially our smaller local government ones.
Members, questions? Senator Wiklund.
Madam Chair, Senator Abler, I mean, I think the paragraph has some openness to it that, you know, it doesn't commit to doing anything, I think. I'm open to having the discussion about whether there are possibilities. I don't know if this, you know, if this binds us to trying to actually do something. I can't say that I can commit to that, but if it's a matter of discussing more with the commissioner, I'm open to having more discussions with her.
Madam Chair,
Senator Abler.
would you like to do this the same with as the last amendment where we can work on it?
Yeah,
I'm happy to do that, Madam Chair. This is, you know, we talked about the feds. This is kind of like Robin. Have you ever read Robinson Crusoe? The ship was wrecked, and then they tried to get all the stuff they could off before it sank. I think if we can get a little federal money before they go broke to help ambulances, I'm all for that. So with that, Madam Chair, I will withdraw.
A16 is withdrawn.
Madam Chair.
Senator Abler.
Thank you. I move A17 on behalf of Senator Pappas.
Senator Abler moves the A17.
This is the birth center facility fee thing. And so I believe this should have no cost because it's actually going to save money. And I know it's lacking a fiscal note, so if it could go on today, so just so we're sure it gets one. And then if it has money involved, then Senator Wiklund can contend with that.
Senator Wiklund.
Madam Chair, Senator Abler, I know that there are many folks who are very passionate about having this included. I do have concerns given that I don't have the financial, you know, what the impact would be. It certainly is, as we talked about it in the committee. And I guess, Senator Abler, is this the same as the bill we heard? Can you,
Senator Abler?
Madam Chair, this is the as amended version in committee.
Okay. I know, Madam Chair, Senator Abler, I know there was a lot of discussion about how valuable this having birth centers is and how it could save money. So I'm not opposed to it in that way. I think if we include it now and we find that there is a fiscal impact, you know, I may have to take action in finance.
Thank you.
Any questions, comments? All those in favor of the A17 signify by saying aye.
Aye.
All those opposed? The A17 is adopted.
Madam Chair,
Senator Abler.
I have the A43.
Senator Abler moves the A43. Go ahead.
So anyway, the A43. So this is about foster youth. We've had a fair amount of discussion. There's been a work group or a task force or something that came back with a report. The action on this was not part of the governor's proposal, although it's very popular with many people at all levels of involvement here, including some of those same people that promote the governor's stuff. So if you recall, in committee, we had a hearing, and I had a delete all, which took the whole. So currently, if you're a foster person and your parents have passed away, there's some Social Security or retirement funds or something that they get. And in many cases, the counties keep them unless you're end up in a Ramsey to pay for services, which is ironically the only people that get services that wind up paying for their own. And so there's talk about having a trust and what happens with that. And there's a lot of controversy there because in the counties that keep the money, they have to give it up, especially in these times. And it seems that the easiest part to talk about is what I brought to the hearing, where we could, those families that have custody could keep getting the money so they can keep paying their rent and like that. And so there seems to be a strong consensus there. The unconsensus is on the part of the foster advocates, is they want to get this whole thing done because they see it as an eminently unfair thing, and I totally get that. So my intention with this, and Madam Chair, this is just to make this bill germane to the resolution that I can come up with. The department has already given me this in the bill and some more details, more work to be done. But if we can put this here, I'm going to continue to work with anybody who cares about this to come up with a way to assure that at least in that slice of it, that the families can keep that revenue while they're in custody of that particular child. So.
Senator Wiklund.
Madam Chair, Senator Abler, I guess I would have a couple concerns, just, one about fiscal impact, which I'm not sure if it would to create the plan. I mean, I'm assuming that it would cost them something. And then I guess my second concern is just that when we had the hearing and concerns seemed to be raised by the foster youth advocates who were there, I'm not sure. I'm concerned about adding something without knowing if that is going to raise concerns with them and become, an issue that I need to address in the bill if it's in there. So I understand the issue, and I appreciate that you are continuing to work on doing something this year so that we do start to address this. I'm a little unsure about including it without having some knowledge of what I'm going to encounter.
Thank you, Madam Chair.
Senator Port. Senator Abler.
Well, I don't think there would be a cost, and actually I presume Ms. Sommerfeld is here to comment, and I don't know if there's any of the foster advocates who are here. We've been having a number of discussions, and their concern basically is that it doesn't go far enough. Nobody objects to this element itself, just that they don't have the full meal deal. So I don't know if you want to discuss it very long. I would, and again, if I could ask you the same, if you don't want to put it on today, I don't care. But if I come up with a resolution with people and you're part of that and people are in agreement, I would hope that I could put that on as a floor amendment and not have germaneness question. That's why I'm doing this as an effort to be a placeholder.
Madam Chair, Senator Abler, I would commit to working with you on it. I think that the cost issue would be the only thing, but
right.
Yeah, we can continue to work on it.
Good. So, Madam Chair, and it would be you that would be concerned about germaneness, and so the bill is full of this kinds of topics. So if I can continue to work, and it would be allowed to be brought as an agreed upon amendment with all the parties, if it could be added, at least without the germaneness question. We have to deal with the fiscal piece. I get that. Is that okay?
Yes.
Thanks.
Senator Abler.
Madam Chair, I've got some homework, I guess. I'm going to withdraw that amendment now.
The A43 is withdrawn. Senator Utke.
Thank you, Madam Chair. Let's do A36.
Senator Utke offers the A36.
I believe that one's got to be passed out.
Which needs to be passed out. You want to talk while it's being passed out?
I will. I see what's, okay. Yeah, thank you, Madam Chair. And as you get it, what it's doing, we had This reverts back or references what was Senate File 1896 that we heard here a few weeks back, and it has to do with the single administrator option for MA and Minnesota Care as far as dental work goes. It's dental carve out now or whatever. We want to delay it. And the bill that was presented at that time was a 4-year delay. Now it's been brought back to just a 2-year delay in putting that practice into law. And so all this amendment does is get rid of the 2-year delay and push it back to the 4 years so that we have 4 years to look at this. There are plenty of concerns with the 2-year. We're seeing the fact that we don't even know where this is going to land yet. The initial response from a number of the providers and these are the providers that care for our MA patients across the state. And so they're doing it with the least amount of reimbursement, and this is scaring them a lot. And I think we need to make sure that we know exactly what we're getting into. It's easy to sit around here and make decisions when we have all the data. We don't have the data yet. I think we need to let this 4-year program or the plan play out so that when something does take place, we know it's going to work. At this point, there's a whole lot of fear out there, and I see it and believe them. It's a very large concern, and so that's the reason for this amendment. It's just going back to the original intent of that bill. What was it, 1896? Let's delay this 4 years and know exactly where we're at. So that's what it, members. That's what it is. Ask for your support.
Senator Bolden. Thank you, Madam Chair. I would ask members to vote no on this amendment. It is clear that we are not ready to make this transition on January 1st of next year as the current statute. So I think we are all in agreement that there does need to be a delay. I will make the case that it does not need to be a 4-year delay. 2 years is enough time to ensure that the work is done, to be sure that we have a stable and sustainable system. No one wants to decrease access or to further disrupt the system. This is a very delicate system, but work is ongoing right now, and my co-author in the other body and I continue to have conversations with all of the stakeholders involved, and will continue those conversations to be sure that we are putting steps in place to be sure that we will be ready in 2 years. Simply waiting is not a plan. There needs to be the work done to build the infrastructure, to have the conversations, to make the decisions, to be sure that we have things in place to be ready in 2 years, and that can absolutely happen in the next 2 years.
Senator Abler.
Well, thanks, Madam Chair. And, if you're not going to do that today, we'll be back next year doing the same amendment. I'm not confident at all in how this has been going. The benchmark of 55% of continuously enrolled people was a ridiculous benchmark anyway. If you understand the demographic we're dealing with here, and my largest percentage of failed appointments may be in this demographic. I serve everybody who comes, and we get lousy rates and don't make costs, but we serve. And so I understand with great sympathy or with great, understanding the population. And we're never going to hit 55%. So whatever you have here for a deadline at 55%, particularly there's not going to be money to make the rates adequate so that the traditional dentists can actually afford to serve them, just to even break even. And they have hard costs maybe of 65%. So I don't know. I'm going to vote for this today, but I'm glad there's a delay. But I can tell you there's a handful of dental operations, including the Owatonna one, that are actually making this work with the way the rates are set up, with the critical access and so on. And we keep tinkering with it. And I think the original proposal was wrong-headed to start with. And so I don't know, I appreciate your confidence. I'm willing to give the departments totalitarian control of their staff. And you're willing to trust them that they're going to, that was meant to be a joke, but you're willing to trust that they're going to get this squared away. And I appreciate that confidence. And I have less of that than you do. So thank you.
Senator Wiklund.
Madam Chair, Senator Udke, I support Senator Bolden's concerns, and I would oppose the amendment. I think that Senator Bolden has been working closely with the stakeholders in this and trying to come up with a way to make sure that we are improving dental access overall, and we are addressing the concerns of the critical access providers who have brought forward to me, concerns about this transition and making sure that it is workable. But I think 2 years is a sufficient time, so I support Senator Bolden in opposing the amendment.
Senator Uckey.
Thank you, Madam Chair, and thank everybody for their comments. I hear both sides of it, but the providers that I have heard from all session were extremely concerned, and that's why we brought this forward. When it was 4 years in the bill, everybody seemed to be happy there. I have just a ton of concern. If everything that we have in this bill and what we just saw in Human Services was to go through, the departments are going to be totally overwhelmed. They're not. I don't see any way possible that they can get through this. So that's another point that's very concerning, is just the vast workload that's being pushed their way. And so the 4-year delay is just a true sense of comfort. I mean, it's keeping that system alive and being able to provide those services for those that have no other alternative. And so I would ask once again for your support on the amendment, and Madam Chair, I would like a roll call.
Roll call requested. Any other comments? All right. Go ahead.
Chair Wiklund,
No.
Vice Chair Mann,
No.
Lead Utke,
Yes.
Senator Abler,
Yes.
Senator Bolden,
No.
Senator Hoffman,
Aye.
Senator Curran,
Yes.
Senator Kupek,
Yes.
Senator Liskey,
Yes.
Senator Port.
There being 6 yes votes and 4 no votes, the A36 is adopted. I am going to move the A32, which will move the start date of the MA reimbursement for home birth services from 27 to 26. Any questions? Thank you. Seeing none. Senator Wiklund.
Madam Chair, Senator Mann, I believe that this has been discussed with the department, and they are able to execute it in that time frame, so I would be supportive.
All those in favor of the A32 signify by saying aye.
Aye.
All those opposed, the A32 is adopted. And I will also move the A35, which is a technical change to the International Medical Graduate Bill. It just removes duplicative language and clarifies that the language in there that's already in there about the collaborative agreement is for 4 weeks. Any questions? Senator Wiklund.
Madam Chair, I would support the amendment. My understanding is that you presented the bill in finance yesterday, and this amendment was adopted. So it would be good to make sure that this is conforming.
All those in favor of the A35 signify by saying aye.
Aye.
All those opposed, the A35 is adopted. Senator, who's up next? Senator Curran.
Thank you, Madam Chair. I'd like to move the A28.
Senator Curran moves the A28, which is it in your packets?
It is not.
It is not, which needs to be passed out. Do you want to talk while it's being passed out?
We sure can. What the A28 does is it's the facility fee prohibition repeal. And so the actual amendment deletes section 3 of page 1 and section 64 of page 44. When we look at the impact, and I think we had great conversations around the transparency and the challenges what this brings forth, is there's a financial impact, I believe, in the first biennium, just over $500,000 to Department of Health, and second biennium, next biennium, it's $700,000. But the impact on the provider network and accessibility to healthcare in Minnesota, specifically rural Minnesota, on the providers, it's $1 billion of impact and revenue that's baked into their current business model. That revenue will have to come from somewhere, and so it'll just make healthcare less affordable and certainly challenge the clinic model, which provides more availability and flexibility for our constituents. Just in my district, I have a cancer and infusion center in the city of Wyoming. If it were to go through, this would drastically impact them. They may be just left with nothing locally and then have to go to the metro for those particular treatments. It doesn't help increase access to the ever-growing challenge of rural health care, and it certainly doesn't help reduce the cost, because that $1 billion is going to have to be transferred somewhere else. But I think we can all agree that the need to work on the transparency so people understand what's being billed and the reason for it, so everybody's accountable. So that's the bill, Madam Chair. Hold on, there was one other one. I think just yesterday too, we also had, I think the conversation is Ridgeview Health. I think they had 3 facilities that were just newly constructed, not quite operational yet. And I think, as they described, this puts those at risk of even being able to open brand new clinics. So with that, Madam Chair, we would love your support, and let's keep working on the transparency part. Thank you.
Senator Wiklund.
Madam Chair, Senator Coran, I do understand the concerns that are being raised, and understand that there could be implications to banning the facility fees. There is more to understand about that, and whether that, it is as drastic as they're stating. But I think that my inclination right now is to continue to have discussions and leave the language in. I agree that transparency in the reporting is really important, and we have included the funding in the budget bill because of that importance, to gather data that we don't have today about how facility fees are being utilized by different facilities. So I would oppose the amendment because it just takes out everything, and then we will continue to have discussions about this provision. I can confirm that for sure, but I would oppose taking it out at this time.
Members' questions? Senator Abler.
Well, thank you. This is another one of those hard things. And at least we all understand the topic, and at least it's more in our scope of what we deal with. I believe it's $1 billion impact to the hospitals, although I don't think they should be charging all these fees. The correct number is somewhere between 0 and $1 billion. I think the $1 billion is excessive and not correct. But in this arena here, where we are about to, there's nothing in the governor's proposals, at least of any substance, no rebasing, no way to, no getting people out of the beds to any significant amount so they can help people get out of the ER and go somewhere else. And so they're left languishing. And I think there's one big hospital group that does pretty well, and they're in the southeast corner of the state, but the rest of them are on the ropes. So I don't think taking it all the way out makes sense. I don't think leaving it. I don't think the proposal of just a flat-out ban makes sense either. So I'm going to vote for the amendment in the hope that as this goes forward, that a good resolution can be found, and just to encourage Senator Wiklund. The good news is that here's the House bill. And they're going to decide in Ways and Means what to do with this topic. People don't know anything about this. So I think that there's going to be a lot of good influence from the Senate bill on the final product. And I hope that Senator Wiklund will take a devisement, if this goes on or off, whichever way it goes, that all or nothing is not the best answer. So thank you.
Any other comments? All those,
Madam Chair.
Senator Liskey?
Thank you, Madam Chair. Madam Chair, Senator Wiklund, I understand where you're coming from, right? There's this fee that we're all definitely worried about. It doesn't necessarily reduce the cost of healthcare, so I think the approach that you're trying to take is by reducing those fees, we reduce the cost of healthcare, so I appreciate that part of it. My concern is that it will negatively impact the financial stability of those institutions and that may end up closing more clinics. As a person who lives in a small town that lost its small medical practice and clinic, I worry that that is what could result from actually carving this language out. And so I would ask, are we capable of maybe putting some comfort language in saying that if it negatively impacts the financial stability of those clinics, that maybe they would be exempt from that specific part of the language? I don't know if there's a happy middle ground, but that's something that I would like to maybe talk to you about and have more conversation with.
Senator Wiklund?
Madam Chair, Senator Liskey, I know that the bill author has been working very diligently with all the parties involved, and I think that she is open to having discussions about that, you know, whether there could be some narrowing of the language. And I also, you know, one of the reasons that this bill came forward is that people were saying that they got to a clinic, they had their visit, and then they found that they were charged this facility fee and that their insurance didn't cover it. And so it was a really significant financial impact on people because their insurance wasn't covering it, and they were surprised. And also just it was substantial, you know, could be hundreds of dollars. There is some very limited transparency requirements for stating the fees, and I think, as you remember, the presenter had the picture of a little sign on a counter that had very tiny language or tiny print about, you know, you might be charged a facility fee, it depends on your insurance, but, you know, and that part needs to be improved too, in my opinion, because that's a patient access issue if they're not, you know, able to find out about these fees ahead of time. So I would just appreciate being able to keep the language in the bill and continue to talk about what reporting can help us with, and also what, you know, transparency looks like for patients. So that would be my request, I guess.
Thank you, Madam Chair.
Senator Graham?
Madam Chair, I'd like to request a roll call.
Roll call requested. Senator Kupak?
Sure, I'd just like to weigh in then before I vote. I share, I think, exactly the same ideas as Senator Abler, and I think the transparency part's important, but I'll vote no on the amendment, even though I completely agree with Senator Abler. I'm going to also have a lot of faith in you, Madam Chair, that you will try to find that sweet middle ground, because there are, in some cases, where these are necessary, but there are cases where they are not. So I'm going to put my faith in you to find the sweet middle ground. So I'll be a no.
Roll call requested.
Chair Wiklund?
No.
Vice Chair Mann?
No.
Lee Dutke?
Yes. Yes.
Senator Abler?
Yeah.
Senator Bolden?
No.
Senator Hoffman? Senator Curran?
Yes.
Senator Kupak?
No.
Senator Liskey?
Yes.
Senator Port?
No.
There being 3 yes votes and 5 no votes,
I passed. I passed. I'm not voting.
the A28 is not adopted.
Madam Chair,
Senator Abler?
I think it needs to be something in the middle. I have great confidence in the chair to continue this work. If this was a floor and the last chance, my vote would be different. But this is a committee that in many ways can work together, and so I hope we can continue that. My objections have been expressed, and I appreciate that. Thank you.
We Very good. We have 11 minutes. Who's next? Senator Liskey.
Thank you, Madam Chair. Madam Chair, I would like to offer the A41 amendment.
Senator Liskey offers the A41, which is in your packets. Go ahead.
Thank you, Madam Chair. Madam Chair, Senator Wiklund, at the beginning we talked about, I heard you talking about the provider tax and how there was hundreds of organizations that supported keeping the provider tax during the time of the sunset, and I wasn't here, so I didn't get to hear all of those organizations. And the question that I would have had for those individuals is, are you sure you want to support a tax that is a pass-through tax which directly increases the cost for patients for their services that they're being provided? And so increasing from 1.8 to 2.0, whilst sounds like a small number, is a very large number, as we can see by our spreadsheet. It directly negatively impacts especially most small clinics. The state of Minnesota is, I believe, the only state that unfortunately impacts all 19 provider types. And it has zero exceptions for small clinics versus large clinics, and including hospitals and things of that nature. Increasing this will only negatively impact those that are most affected, which are the small clinics. And so I have concerns changing it again from the 1.8 to 2.0, and in fact it was 1.6 until we decided to empty the Healthcare Access Fund last biennium, and so it had gone from 1.8 down to 1.6. Now we're raising it basically a 0.4% in the last 3 years. So with that, that's why I'm offering this amendment.
Senator Wiklund.
Madam Chair, Senator Liskey, thank you for your comments. I guess I disagree. I think that this is a mechanism that we can use to help protect our healthcare access for Minnesotans. If we weren't able to do this, restore the tax to 2%, I really believe that it would have a drastic impact, obviously, on the budget, which your amendment does not address how that would be resolved. And I would be forced to make actual, cut services. The budget doesn't work in a way that we are adding a great deal of service, that we aren't expanding services greatly. We're using this capability to allow us to maintain coverages and add a few very low-cost coverages. And I think protecting healthcare access for Minnesotans is important and very important. And I think that increasing it by 0.2%, I believe, is a reasonable way to accomplish this sort of stability for us. So I would oppose the amendment.
Members? Okay, seeing no questions, all those in favor of the A41 signify by saying aye. Aye. All those opposed? No. The A41 is not adopted. Who's next? Senator Abler.
I have an oral amendment, and online on page 84, line 2. And this has to do with the fees, and my oral amendment is to strike the 400 and insert 250. And I can explain the chiropractic board, and I think there's some other boards that there's been a trend of going up to, and the board can reduce it. And this particular, if you look at the spreadsheet, it assumes that all these fees are going to go to the max, and there's a appropriation of the amount of money that they really wanted, and then a surplus in that segment of the fund. And so, if you go back to page 79, you look at the Board of Medical Practice in the more traditional way. If they want money, they ask for it, and they have some specific license fees that they're asking for, which has been how it's been done much in the past, and so we keep our hand on it. That's a much superior way. That way it forces the boards to come talk to us once in a while, and then we understand what they're about and helps our oversight. And the podiatrists have a fee. I can't find their language. Is another example. It generates, you look at the fiscal note, it generates revenue, but it's not appropriated. I don't know if they have a deficit or something, but this up to thing is just not a good practice. My intention is to do this today, and then if and then to clean up the rest of the other fees to be what they ask for. Nobody's objected to giving them the money they ask for. We're just objecting to giving them kind of a blank check. So, thank you.
Council?
Senator Abler moves to amend page 84, line 2, delete $400 and insert $250.
Senator Wiklund?
Madam Chair, Senator Abler, we spoke about this. I understand your concerns, and I'm willing to accept it. I do want to get feedback from the boards and, find out what the response is. I know that we had discussion very early in the session, a long time ago, about language that was the up to, being able to assess up to a certain amount, and we had concerns about that, but we didn't, take it to how we would actually resolve that. So I'm willing to accept it today, and just want to consider what the boards might say in response.
Thanks, Madam Chair. I know we're running short of time, but I'll keep working on this. It's meant to be totally favorable to the boards, just fair to all the providers as well, and keep the transparency there. So I think the Board of Medical Practice has had a stellar example about how to do it. Thank you.
All those in favor of the oral amendment signify by saying aye.
Aye.
All those opposed? The oral amendment is adopted. Who's next? Senator Uckey.
Thank you, Madam Chair. I'll give you the number. It's the 825 amendment, but I've got some things so that way they can pass it out. But I've got some things to go over before we get to what the amendment really says. Because, Madam Chair and Senator Wiklund, the 825 references Article 22, the back of the bill, and it's about the premium subsidy program. And I do have a bunch of questions on that. When this bill, as I follow the process of it, started here, went to Commerce, got laid over in Commerce, and on the second try made it out, went to Judiciary. But all along, didn't this bill pay for or fund reinsurance, or whatever we want to call it, with general fund dollars?
Senator Wiklund.
Senator Utkey, I'd have to go back to what the original bill was that we sent out of here. I mean, the original plan had, it needed funding, and it would have been the general fund, but now, we have an assessment that funds it.
Senator Uckey.
Thank you, Madam Chair. I believe it was general fund dollars, because actually the fiscal note, I believe, was, about $513 million, because we had your offering, and then we had Senate File 333, which came from Senator Dames, which was just a little bit less. They were both over $500 million, but both taking money from the general fund to make this program work. All of a sudden, the subsidy program comes about. Where did this come from?
Senator Wiklund.
Madam Chair, Senator Utkey, I'm not sure I follow. It's Senate File 1024, which is what we heard in the committee. And then it went Commerce, we had the hearing in Judiciary, and then it was referred back to this committee. And that is, we made some modifications, but it's the bill, Senate File 1024. And then we included the assessment to pay for, or to fund it.
Senator Uckey.
Thank you, Madam Chair. But Senator Wiklund, isn't it true that Senate File 1024 again was using general fund all the way up, even when it passed out of Judiciary, and now it shows up in our delete all, doing a subsidy program? That was never heard, as far as I know, anywhere, unless you can enlighten me on that.
This, Madam Chair, Senator Utkey, the basic format of the program, the subsidy program, is what we heard in this committee. And then it had to go to those other stops and return here. And that's what we've included. And it's paid for with an assessment. And so it would raise, the assessment would raise sufficient funding to cover the cost of the subsidy.
Senator Utke.
Thank you, Madam Chair. Okay, and so then I'll just, before I go further, jump into what the 825 amendment does. And of course, it's just deleting sections 1 to 5, 16, and then 19 and 20, which is the premium subsidy program. And I've got some things I want to highlight, but I feel from what I see, this hasn't been discussed the way it should. Plus, we've got Senate File 333, and I think at this point, I would like to see this move forward without anything in it, and we continue to have conversations on what is the best way to approach this reinsurance issue, and how are we going to make that would be the individual market and our small group market, how are we going to keep that so that it's somewhat affordable? Without reinsurance, the market blows up, and we know what that looks like from a handful of years ago or back in 2016, 2017. But some of the things I want to highlight on what's in this is, starting with the 20% subsidy, where the consumer is going to get a 20% reduction on what is shown to them as a health care premium. But who's paying that? But that is the health plans. And I wanted to jump into, okay, when you look at what a health plan company is, and then you go into statute on who is going to be assessed across this whole broad spectrum, and when you follow it through in statute, the health plan company is the health carrier. It's a community integrated service network. But then as we go further, what is that? I mean, it ends up everybody and anybody that's attached to selling a health related product is going to be assessed, including our self-insureds, and the community integrated service network or community network, that even could assess the premiums on out-of-state clients or purchasers, enrollees. I mean, this thing has just gone crazy as far as who is all going to get potentially charged back for this. This doesn't do anything to help reduce the cost, because no matter who is paying those bills, it's all going to go back to the consumer. When we buy a policy on the market, we as consumers are paying the bill. Nobody's going to absorb these things and make them go away. And so that is the reason that I'm doing this delete of those sections, so that we can have further conversations on what will work, because right now the way it looks, we're going to see a massive increase in the cost of our health plans, and which drives up, when those plans go up, it's reducing care, because we already have people that I run into that tell us, I can't afford to buy health insurance anymore, and they're going without. This is going to make more of those, and that's the biggest concern. We don't want people going without health coverage, and I see this as just taking us in the wrong direction. So, members, that is what this is about. At this point, I would like to see this section removed so that we can have debate on this around the hearing table, and hopefully, well, in fact, we have to. We've got to come up with something by the end of the year, because our current reinsurance is sunsetting. So, thank you, Madam Chair. Thank you, Senator Wiklund.
Senator Wiklund.
Madam Chair, Senator Utke, I think, I guess we have a difference of opinion on how to solve this issue. I agree that the premium subsidy account isn't funded after this year, so we do need to look at what could happen if we don't have a program in place. And I do agree that we do need to find a way to put money towards a program that does address the what reinsurance is addressing today. Whether that is reinsurance or this premium subsidy program, I think that's where we differ in our approach. I think that the subsidy program is a way that is more transparent. I think it presents the consumer with the ability to see what is being provided, whereas reinsurance really is not visible to consumers. It's just not transparent. I think the premium subsidy has an advantage is that it's targeted to the people who are not receiving premium tax subsidies. Their premiums are held to a certain amount of their income, whether rates go up or not. People who don't, receive a subsidy, they will experience the rate increase. And so this premium subsidy program allows us to target those individuals and not like reinsurance just is targeting everybody in the individual market. I think the approach to take or to have an assessment to pay for it is something that many other states have chosen to do as they implement a reinsurance program. And so I think that looking at what the program will cost, which for reinsurance, Senator Dames' bill, that was about $512 million. The premium subsidy bill, I think, was similar in the fiscal note we received, but we need to have that reviewed and refined. But really, we don't have $512 million in the general fund that we're going to be able to devote to this program. I think we need to look at an alternative, and this assessment would provide us a way to do that. Whether the entities that are taxed, whether the term that we have in the bill today, I have received input from stakeholders who say that the way we have it worded is something that we should discuss, and I will be doing that with Senate Council to make sure that who we think should be assessed is what is contained in the language, because we aren't trying to capture other non-health insurance type entities. However, we have to be technical about the language and get it right. So that is definitely open to more discussion.
Any other questions? All those in favor? Senator Rucky?
I didn't know you were going to end it so quick. But anyhow, thank you, Madam Chair, and thank you, Senator Wiklund. I would hope and ask that we can continue to have these conversations, because as I see it, in the end, the consumer, and in the end, across the board, the consumer always pays anyhow, but in this case, the consumer of health products, buying health plans, is the one that's going to have to, they're going to have an increase. And, we're all about making healthcare more affordable and more accessible. And, I'm just not sure that this is going to help. In fact, I have some serious concerns, but I appreciate your comments and hope that we can continue to work on this as the days move forward, so by later in May we have a solution that we can all stand behind and be proud of. Thank you.
Do you want to withdraw the A25?
No.
Okay. All those in favor of the A25 signify by saying aye. Aye. All those opposed?
No.
The A25 is not adopted. Any other amendments? Seeing none. Senator Wiklund.
Madam Chair, members, I really appreciate the discussion today. I definitely, if there is another aspect that we didn't cover that you'd like to discuss, I'm definitely open to doing that. This is one step in the process, and we hope to pass this amended bill out, and it needs to go to the tax committee. But we have another step in finance and on the floor, so I hope that you will continue to bring me, questions or concerns we can talk about. I am pleased that we were able to present a bill that doesn't make significant cuts, and we had ways to be able to accomplish that. Also appreciate the things that members brought forward as bills this year that we were able to include. We have many bipartisan bills and some Republican bills and Democratic bills. And so I really appreciate all of the time that you spent in creating bills to bring forward and the discussions we had in the committee. So I hope I can earn your support. So, Madam Chair, I believe, would the motion be to recommend that Senate File 2669 as amended be recommended pass and be referred to the Committee on Taxes? Oh, and there's all that other language that has to go along with it.
And that the staff make technical and conforming changes as necessary to reflect the intent of the committee. All those in favor signify by saying aye.
Aye.
All those opposed? The motion prevails.
Madam Chair, I just also want to thank staff and thank you for all the work that went into getting us to today and will continue going on, but appreciate it. Thank you.
Thank you very much. We are adjourned.